Nursing was one of the toughest jobs before the pandemic, and now it's gotten even harder for hospital workers on the front lines. KMBC 9's Chris Katz worked with the University of Kansas Health System to show you what a normal shift looks like for one nurse when nothing is normal anymore.
Good luck keeping up with ER nursing supervisor Tiffany Clark.
Hi, how are you?
Because on this day last August, all the ER rooms were full.
Again, so sorry we've got you in the hallway. It's just with things being so full right now.
And patients had to be cared for out in the hallway.
So Stacy, I think it's about time we probably open up a few hall beds.
And it's like this a lot.
But it may just be 10 patients, 12 patients, but we can quickly get to 25, 32. These are random numbers, but just numbers that I remember in my mind looking at the tracking board of what's in the waiting room, all the way up to 44 people in the waiting room. And so those are sick people in the waiting room, and I would rather them be sick in a bed in the hallway where I can keep an eye on them than sick in the waiting room where I'm not going to be able to watch them as well.
Her job includes finding ER rooms for sick people, especially on days when there are none. She makes sure there's enough staff where it needs to be.
Also, forgot to mention, patient is 10 days or 10 days post-positive COVID-19 diagnosis.
And all as COVID makes everyone's job so much harder.
Yet this virus really seems to be taking you for a loop.
It's true the pandemic isn't what it was in the spring of last year, but those patients are still coming.
We're using everything that we can possibly use. We're using every bit of ourselves, every inch of our real estate available, all of our resources. But again, when all of your resources are to the limit, you do feel a little helpless because you're like, okay, I don't know what else to do at this point.
In the beginning, there wasn't enough PPE. There was no vaccine. There was just so much they didn't know.
And you just don't know what's coming in the front door. And so that's always in the back of your mind. But with something like COVID, that you don't have a whole lot of tools or weapons against at the time, that was definitely a fear of mine.
Clark says a reliable vaccine was and continues to be a real game changer. And while this pandemic isn't over by a long shot, she and so many others are thinking about the next one.
We'll be like, okay, we've done this once. We've learned a lot. We're going to use what we learned in the previous situation and we'll apply it to this one. But again, you're always going to learn something new in every situation. But I think it absolutely opened our eyes to what really could happen when a pandemic like this happens.
Chris Katz, KMBC 9 News.
Clark has a husband and family, so the worry about bringing the virus home has been real from the very beginning. One thing she says that they've learned at the hospital is to lean on each other to get through the worst times. Well, then President Trump's blood oxygen level was dangerously low after he tested positive for COVID-19 in October 2020. That is according to former Chief of Staff Mark Meadows in a new book. Meadows says the president's blood oxygen level dropped to 86%, which prompted the White House doctor to recommend the president go to the hospital. He was flown to Walter Reed Medical Center for treatment that night. The World Health Organization now recommends against using blood plasma from recovered COVID patients to treat current patients. The UN Health Agency says the transfusions are costly, time-consuming, and have not been shown to prevent severe illness or death. The change in guidance is based on results from 16 trials with more than 16,000 patients.